I'm excited to welcome to the program. Roll, Doc. Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And today's topic, risk of VBAC versus repeat C-section. What is a VBAC?
It's an acronym. It stands for vaginal birth after cesarean section. If you've had a previous C-section, you may want to consider having a VBAC versus a repeat C-section.
What is the risk of having a VBAC compared to a repeat C-section?
Well, Neil, the biggest risk of all is, of course, death. We don't like to talk about that very often, but the risk of dying from a VBAC is 0.0038%. The risk of dying from a repeat C-section is 0.0134. So the risk of dying from a repeat C-section is 30 times greater than dying from a VBAC. So the VBAC is safer most of the time.
What are the specific risks associated with a repeat C-section?
Well, a big one is bleeding. The next one is infection. Then you've got damage to nearby organs. You have abnormal placentation, in other words, placenta accreta, where the placenta grows into the uterus, and you have placenta previa.
What is the successful delivery rate for women who attempt a VBAC?
Most women will have, most often quoted, 60 to 80%. In my experience, it's been closer to 90%.
Should I consider having a VBAC?
Well, there are some people who are going to have a better chance of having a VBAC. They include being younger than 35. Of course, the incision should be transverse, which means going this way and not going that way. And then, of course, for women who have a big baby, that's not good. A normal-sized baby. You should have a normal pelvis. Certainly, there are women who've had an injury to the pelvis that would preclude having a VBAC. So, there are situations that make a VBAC better.
What if I attempt to VBAC and it fails?
Well, that's of course the biggest risk, and it's a situation where you have the worst of both worlds. You have the labor, and you have the lots of exams, and you have still the risk of having a repeat C-section. So the thing that really happens to you when you have one of those, we call that a CBAC, is increased risk for infection.
What is the risk of a CBAC versus a VBAC or repeat C-section?
Well, there are people who say that anytime the uterus is contracting, that you have a greater risk. That's just not true. But the risk is, again, infection and hemorrhage for a CBAC or a repeat C-section.
What is the chance of a uterine scar rupturing during a VBAC?
Well, the average risk is 0.7%. If you take a normal labor without any induction, it's 0.5% or 1 in 200. And if you have a Pitocin induction, they say it's between 0.9 and 1%. If you have a prostaglandin induction, they say it's 1.4 to 1.8. These are just standard figures. I don't agree with them. I think that this risk for rupture is just not accurate, but this is what the NIH study showed.
What if my doctor doesn't want to do a VBAC?
Well, don't argue with your doctor. That's the first piece of advice. You're not going to change the doctor's mind, and you're just going to set up a contentious relationship. So don't argue. If you really want to be back and your doctor says no, find another doctor if your insurance will let you.
All right, best place to go is worlddocallen.com and pick up Pregnancy Your Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was World Doc Allen Podcast Casting.